Good morning. Today we'll be taking about the cardiotocography.
Today we are going to talk about the non-stress test. So before going to the procedure, we will like to discuss the parts of the NST machine. Here we can see all the parts have been displayed over here. This is the NST machine on the whole. This is a screen which is going to display our NST result, and these are the abdominal bells which will help to apply the transducers. We have two different transducers. One is a tocoprobe. This is a tocoprobe which is marked by a green color, and this is the USG transducer that will record the fetal heart rate. This is the fetal movement counter which is used to display the fetal movements and is present with the patient in patient's hand. Today Now we are going to start with doing the NST of the patient. For doing that, we have to attach the probes. As you can see, we have already attached the probes in the two parts over here. Before attaching the probe to the patient, we have to make sure that the patient have had an adequate meal, and the second thing, the patient should be positioned in the supine position with a 15 degrees lateral tilt. For this, we have used in support over here in the near the buttocks of the patient. Now we have attached the two probes you can see over here. One is the USG transducer, which I have already shown you. That was purple in color. Over here we can see. Before establishing the position of the USG transducer, you have to locate the fetal heart rate, because this transducer is going to pick up the fetal heart rates. The second transducer which we have already seen was the toco transducer. So toco transducer is said to record the fetal uterine contractions. For this, you have to place the toco probe at the highest point on the fundus. After attaching these two probes, we are going to check on our machine. Now we are seeing the machine over here. After placing both the probes in position, here in the machine we can see we have two parts. One is the screen part of the machine and the other is a print which is coming out from the machine. So in the screen part, you can appreciate there are three important divisions. First division, this green line which is showing us the normal heart rate of the baby or fetus. So you can see this is the heart rate or the graph of the heart rate of the baby fetus coming over here. The second probe, that was the toco probe, that was presenting the uterine contractions. So this patient is not having a uterine contraction, so a baseline uterine contraction heart graph is coming over here. Tocograph is coming over here. The third thing we can appreciate is these small yellow lines on this CTG graph. These are representing the fetal movement which was being marked by the fetal movement counter by the patient. These representations can be taken in a print form in the NST graph.
Here you can see the graph. The graph is showing these are the tracings of the fetal heart, and there is a variability. You can appreciate variability of 5 to 20 beats per minute, and the variability of the fetal heart is good. And here on the tracing below, you can see that the toco probe is showing very mild contractions, and these tracings, the patient is not in active labor. These are simply the Braxton Hicks contractions which are normally present. Another tracing here, you can see that the patient is in early labor. The contractions of the uterus can be seen over here, and at the same time the variability of the fetal heart is very less, something like 2 to 5 or that much. But on the other part, when the uterus is now here relaxed, the variability is better. So that was how you see the tracings and how you record. These recordings were taken with the consent of the patient, and I specially thank Dr. Soumya Singh, Associate Professor Obs and Gynae MIMS, for showing CTG machine and the recordings. If you could understand CTG, please subscribe, drop a like and share. Thank you.